An open or sucking chest wound is an injury that punctures the chest and allows air into the chest cavity. If a casualty appears to have an open or sucking chest wound, first, check for both entry and exit wounds. If an exit wound is present, both wounds will have to be treated. Look for blood pooling under the casualty's back. Use your hands to feel for wounds. If there is more than one open chest wound, begin treating them in the order you find them. Next, expose the area around the open chest wound by removing, cutting, or tearing the clothing covering the wound. If the clothing is stuck or adhering to the wound, do not try to remove it. This may cause additional pain and injury. Instead, cut or tear around the stuck clothing. Do not try to clean the wound or remove debris from the wound. The next step is to seal the wound. Since air can pass through most dressings and bandages, you must seal the open chest wound with a chest seal or occlusive dressing, like soft plastic, cellophane, or other non-porous airtight material, to prevent air from entering the chest and collapsing the lung. Different commercial chest seals may have their own instructions, so follow the appropriate steps for any product you're using. Generally, when using a chest seal, carefully remove the adhesive chest seal from its wrapping. Clean the area around the wound by wiping away dirt and fluid with gauze. Place the chest seal adhesive side down and with the vent, if one is present, centered over the wound. Ensure that the adhesive material is properly pressed against the skin for a good seal. If there is a second open or sucking chest wound, repeat the steps you followed for the first wound. If the casualty is conscious, place them in a seated position or on their side in the recovery position with their injured side next to the ground. This will help stabilize the injured side and reduce pain. If the casualty is unconscious, place them in the recovery position on their injured side.